Levothyroxine in women with thyroid peroxidase antibodies before conception.
Sustainable glycerol definition.
A synthetic thyroid hormone used as a thyroid hormone replacement drug. Brand names include levothyroid, Levoxin, Levoxil, Santroid, used to treat an underactive thyroid gland.
The reason why they found that is important to clarify that there are two kinds of hypothyroidism.
Oh.
So the first class is when your thyroid levels are actually low. And in that case, giving the medicine makes absolutely sense. You're just replacing what is needed.
Your thyroid hormone level is low.
Exactly. So the thyroid is not producing enough. It's producing 80, 60, 50, 40%. So the physician will find that something is abnormal in your blood test and will give you the medicine just to normalize the values. So that is completely
pretty clear cut.
Pretty clear cut. The second, which is more frequently found, very common, is when your thyroid levels are actually normal in your blood, but the signal from the brain is high, suggesting that your brain is sending a signal to the thyroid just to tell the thyroid to work more. That we call subclinical hypothyroidism.
Subclinical, yeah.
So the prevalence of the
application and nursing.
Hi, I'm Dr. Mark Charles, Director of the IVF Center here in Orlando, Florida. Thyroid function is critically important for fertility as well as pregnancy health. When you have an abnormality in your thyroid, whether you have hypothyroid, which is low thyroid production, or hyperthyroid, which is elevated thyroid production, they both can affect your ability to have a baby. When your thyroid is not functioning properly, it can actually impair your ability to ovulate, reducing ovulation function, and infertility can result. So a simple blood test called TSH can monitor your thyroid and let us know if it needs treatment. Now, how does thyroid affect pregnancy? Well, we know that in both
Pros and cons. Hypothyroidism can sometimes cause infertility in both men and women. Levothyroxine should not be used for the treatment of infertility unless it is caused by the
It's the most prescribed medication in the U.S., with more than 120 million levothyroxine prescriptions written each year. The drug's purpose is to raise low thyroid hormone levels for a condition called hypothyroidism.
But the majority of these patients will be surprised that actually they don't need it.
Mayo Clinic endocrinologist Dr. Juan Brito says more frequent testing is partially to blame, as well as hypothyroidism's very common, somewhat vague symptoms.
Weight loss, hair loss, dry skin, fatigue, low energy, those are symptoms of many other conditions. Actually, they are symptoms of just life sometimes.
Dr. Brito says that's why many patients' symptoms don't improve with a daily pill. He urges physicians to have valid reasons for prescribing levothyroxine and to follow up in 3 months' time to see if the patient benefited.
And that is the key, is to reassess. The majority of patients get treated and never really have the chance to withdraw the medicine and then just get treated for the rest of their lives.
For the Mayo Clinic News Network, I'm Dennis Doda.
issue applied in equine. Replacement or replacement therapy when the thyroid function is displaced or completely absent. Hypothyroid, retinism, maxedema, not toxic urea. Hypothyroidism in general.
In this video, we're going to have a look at the thyroid gland and the hormones that the thyroid gland produces. We're going to take a look at how those thyroid hormones are produced, where they act in the body and what they do, and also what stimulates their production and their release. Now, the first thing we need to talk about is the thyroid gland itself. Now, there's going to be another video on the anatomy of the thyroid gland, but we need to be able to identify where it is. First thing is that if you take your windpipe or your trachea, and you were to get your finger and you run your finger down the anterior aspect of your windpipe, you would feel your Adam's apple. Now this is known as your laryngeal prominence, and it's made up of laryngeal cartilage. Now remember, both males and females have an Adam's apple. Why? Well, it's just the laryngeal prominence. It's more prominent in males because it's a secondary sexual characteristic, and testosterone makes it more pronounced in its size. So if you were to feel your Adam's apple, and then you were to continue down and
Levothyroxine in thyroid. Women with thyroid peroxidase antibodies did not result in a higher rate of bleed birth than
Hi, I'm Dr. Raymond Douglas. I'm an oculoplastic and orbital surgeon from Beverly Hills, California, and today we're here with Pejman Cohen. He's an endocrinologist here in Beverly Hills, and we're talking about Graves' disease. And this segment, we're talking about antibodies, because that is the bane of every oculoplastic surgeon's existence when someone presents with all these antibodies and we don't know what to do with them or what to make of them. And I know the patients are equally as frustrated by the alphabet soup of these names and abbreviations. And so I'd like to make a little bit of sense of those antibody levels. What are they? They're very similar to a vaccination where we make antibodies from our B cells, but these antibodies are made very specifically to receptors and other things in our body. And so Dr. Cohen is going to explain a little bit about what these antibodies mean in relation to autoimmune thyroid disease and specifically Graves' disease. And thank you so much for helping to put some clarity to this.
Absolutely, yes. The antibodies are important diagnostic tools, and they're important for us to be certain that the thyroid condition is immune related or not, because although the majority of thyroid problems are autoimmune, there are some that are not. Like some patients have, for example, a nodule that could be releasing extra levels of thyroid hormone, and that condition, of course,